Hello, and thank you for joining us for this week's edition of It's Your City. I'm your host, Cortney Bloomer, here in our studios at the Brewery Arts Center with this week's guest, Syndi Skilling from Carson Tahoe Hospital. She's the Diabetes Education Program Planner, and November is Diabetes Month, and we're so happy you could join us.
Thank you for having me. I'm glad to be here.
So, diabetes is a problem that affects millions of Americans, and many people are at risk and may not know it. Tell us a little bit about diabetes. What is diabetes?
Well, diabetes is a condition that affects your hormone system, and specifically the way that your body uses insulin. And there's two different types of diabetes. There's type 1 diabetes and there's type 2 diabetes. And type 1 diabetes is typically found in young children or people under 20. And it's a complete absence of your body's ability to make any insulin at all. So the treatment of choice is always by giving insulin injections for a lifetime. At this time, there is no cure for type 1 diabetes, but then there's also type 2 diabetes, which affects so many more people in our population. Actually, about 29 million people in America have type 2 diabetes, and that's 1 in every 10 people. So it really does impact a large group of our population, and many of those people don't even know that they have it. And some of the things that are going on with someone who has type 2, there's several risk factors involved that can put them at higher risk for developing type 2 diabetes, and that could be age, ethnicity, family history, weight gain, and also a sedentary lifestyle. So inactivity can really give you a higher risk for developing type 2 diabetes. And type 2 diabetes is a condition where you have developed some insulin resistance. So the insulin that you normally make isn't working as well, and then your pancreas is required to overcompensate for that, and then eventually you don't make as much insulin anymore, and the blood sugars increase, and that's when the diagnosis happens.
All right, and so we're seeing an increase in the number of folks who have diabetes, and as you mentioned, many of these people who have diabetes don't know it.
Right.
What are some symptoms that people might be looking for that could alert them to the fact that maybe they need to see their physician?
Anybody who's over the age of 45 and is overweight and maybe has, kind of developed a sedentary lifestyle, if you have high blood pressure or high cholesterol as well, all those things indicate that you really should get screened by your physician for a fasting blood sugar. And some physicians will do an additional test called an A1C, and those would be the key factors to diagnosing the diabetes. So some symptoms would be, if you started getting more tired more frequently, just lack of energy, if you become thirsty or have to urinate frequently, or in rare extreme cases, some people might start losing weight. But, and sometimes also you might experience some wounds that aren't healing. So, generally I would encourage everyone to really make sure that they stay in touch with a local physician and that they're getting annual lab work, and to include that fasting blood sugar, and potentially, if they are at risk, getting an A1C done as well.
Okay. Now, there's a lot to learn about diabetes, more than we just went over. And Carson Tahoe is working to bring more diabetes education to the community. This month, as part of Diabetes Month, there have been a series of workshops that people could attend, and there's one more coming up. Tell us about that.
Yes, on Thursday, November 19th, we're going to have a workshop at our Health and Wellness Institute, which is right there on Medical Parkway, adjacent to the hospital. And we will be hosting several of our practitioners. We'll have physicians, cardiologists, and and a primary care physician, as well as exercise specialists and physical therapists and nurses and dietitians. And basically it will be an opportunity for people to get some lecture type information, but also some hands-on interaction with some of the technology that's out there and some of the techniques that are out there to help people who have diabetes manage it and live well and continue to live healthy with diabetes.
All right, and that's on November 19th.
Yes.
And what time?
Okay, yes, from 11 to 1.
Okay.
So it would be best to come to the Health and Wellness Institute, at 11, then you'll have the whole opportunity to experience the whole thing. And so 11 o'clock to 1 o'clock in the afternoon, and we will have some refreshments. So we do welcome the community, and it's free and open to the public and anybody who's interested in learning more about diabetes.
Do people need to schedule if they're going to be there, RSVP, or is it just welcome to show up?
Welcome to show up. Yeah, this is an event that's just open and no reservations are required.
All right. Fantastic. So hopefully some people will come take advantage of that and learn about diabetes and what they might be able to do to improve their own health.
Yes.
Now, the time to tackle diabetes is before you have it, by adopting some healthy lifestyle behaviors and things if you are at risk for diabetes. Folks who do not have diabetes yet, but are concerned about it, what can they do?
Well, one of the recommendations from the American Diabetes Association and from the Centers for Disease Control is to get active and lose weight. And actually the recommended weight loss is about 7%, but to maintain that over a lifetime and to continue to stay active for a lifetime. And coming up in 2016, Carson Tahoe will be launching the National Diabetes Prevention Program as well through our Health and Wellness Institute and in conjunction with our Diabetes Education Program. And we will be educating people and walking with them through this program to help people learn how to prevent diabetes and learn what their risk factors are and how they can either prevent or prolong that diagnosis. So.
Fantastic. So coming in 2016, when is this going to start?
We'll be launching our first program in January, and the groups will develop as a concise group that will continue on through the whole program for the year, and then we'll launch subsequent groups throughout the year each month as the need presents itself. So,
how long does the program last?
This program for the National Diabetes Prevention Program is actually a year-long program and focused mainly on that weight loss and physical activity and developing those life skills to learn how to prevent diabetes. So for 6 months, there'll be 16 sessions that meet over the first 6 months, so not quite every week, but pretty frequently there for a while. And then after the first month, then we go into more of a maintenance phase, and it's once a month at that point for the rest of the year.
So folks are going to be able to get a lot of support from their group. How can people sign up to be part of this, and how many people are going to be in that first cohort?
We're looking to try to capture about 20 people for each class, 20 to 25 people for each group class. And they would be best to call the Carson Tahoe Health and Wellness Institute or myself at the Diabetes Education Department. My number is 445-8607, and people can reach me there if they are interested in finding more out about the Diabetes Prevention Program.
All right, and you are the diabetes educator at the hospital, and you deal with a lot of patients. Some people might need more one-on-one counseling. What does Carson Tahoe offer for them?
So as far as the Diabetes Education Program goes, what we have is a program to help people establish those healthy lifestyle behaviors to manage the chronic condition of diabetes, whether it be type 1 or type 2, for a lifetime. And they do need a physician referral, so their doctor needs to, they need to consult with their physician and ask for a referral for diabetes education. And once they are referred to our program, they meet with me for about an hour and a half, and we do an initial assessment, really get to know them and decide, with them what their needs are, what particularly they want to know more about, and how we can help them. And then after the initial appointment, we can also refer them for additional nutrition therapy if they need that as well. But we have a comprehensive group class that meets monthly, and it's 3 sessions for 3 hours each session, and it covers all the basic care for diabetes self-management. So that would include nutrition, monitoring, exercise, taking medications, learning how to cope with this chronic condition, learning how to overcome some of the obstacles and those skills for managing things that come through life. How do you deal with that? And really just trying to help people develop those skills so they can improve their life with diabetes.
Now, managing diabetes is an important topic. My grandmother had diabetes, and I watched her, having to take insulin shots and things like that. But nowadays, there's many things that people can do to make it easier. There are healthy recipes that people can access. Groups like those offered at Carson Tahoe, where people can come together to support each other. And what other things are available? What resources would you direct people to if they want to learn more?
Definitely. We have so many things going on at Carson Tahoe. We have a lot of healthy eating classes. There's actually a program called Intuitive Eating. It's not necessarily specific for diabetes per se, but it's just great information on how to look at food in maybe a different way than you've looked at food before, because food does have so much to do with managing diabetes, and there's so many great recipes offered there, and awesome ideas on how to really take a healthy look at the food that you're eating. And so there's so many programs going on. We have yoga classes, exercise classes, as well as I also host a diabetes support group on the second Thursday of each month at the Health and Wellness Institute as well. But to get started, I would recommend people to go to the American Diabetes Association website and check out the website. So you would go to www.ada.org, and I'm sorry, that's diabetes.org, and or Google search the American Diabetes Association. And they will have so much information about how to get started with diabetes care, and they also will send you out information to your home in the form of leaflets and magazines and healthy tips on
Right. You can subscribe to emails. They'll send you recipes and different things that you can take advantage of.
Absolutely. Yeah.
Well, diabetes is certainly something that folks need to be concerned about, but not something that they should be scared to find out about. People who have diabetes, their lives can really be improved by learning their diagnosis and taking the appropriate steps.
Absolutely. I would encourage people to, like I said earlier, be in touch with your primary care provider. Seek out those labs that will help decide the diagnosis, and especially if you catch it early and treat it aggressively, you really can continue to live very healthy with diabetes. And many of my patients actually have self-reported that diabetes was the best thing that's happened to them because they really began to take their health seriously.
Right, sort of a wake-up call.
Yeah, that wake-up call, and people just understand that maybe the things that they hadn't thought about in the past really were important, and so now they begin really getting on this track of exploring healthy recipes and getting out and enjoying this beautiful Sierra Nevada mountains that we have and this beautiful community that we live in, and just enjoying that daily afternoon walk and the crisp fall air,
Right.
So there's so many things that people can do that are enjoyable and fun, that are healthy lifestyles.
Right.
So.
Now, coming up here in just a few short days is one of the holidays that is hard for people with diabetes, Thanksgiving.
Yes.
It's coming up, and we really associate Thanksgiving with a lot of food. It's a food holiday.
It is a food holiday.
What is a tip that you have for people who may be hosting a Thanksgiving celebration or for diabetics attending a Thanksgiving celebration?
What I like to tell my patients, first of all, don't beat yourself up. Always, enjoy your family, but enjoy the food in smaller quantities. Portion control is always advisable. Maybe last year you went back for seconds or thirds on the mashed potatoes. Maybe this year just have the half a cup of mashed potatoes and that's it. So I really like to encourage people to find new recipes that might include some of those non-starchy vegetables, some greens and leafy greens. You could add, spinach to your dish or a green salad rather than concentrating on all those carbohydrates.
Right.
We have so many starches in the potatoes and the yams and the stuffing, and try to find something that has some green in it and add some of those leafy vegetables that are less in calories and way less in carbohydrates, so you won't experience such a high fluctuation in your blood sugar if you do have diabetes. So.
Right. Well, some great tips. I just want to recap. On the 19th is going to be the special diabetes event at Carson Tahoe. And coming up in January, the new class, folks can learn about that on the Carson Tahoe website.
Absolutely.
And that is on the screen. We encourage folks to go there. And if they have any other questions, certainly to call you. Syndi, thanks so much for being with us today.
Thanks for having me, Cortney.
Absolutely. And thanks to all of you for joining us for this week's edition of It's Your City. I'm Cortney Bloomer. We'll see you next week.